In this case study, we will focus on the product Enteryx and use this product to illustrate some of the fundamental and philosophical differences between medical device versus drug clinical trials. To begin, the indication for Enteryx was GERD, or gastroesophageal reflux disorder. To help illustrate, let me share with you a short video on the pathophysiology of GERD. As we have seen many times, it is very powerful to begin any discussion not with the regulation, but with the pathophysiology. We must always begin with the pathophysiology or the biology first, and then let everything else, including the regulation, follow. So here's a short primer on the pathophysiology of GERD. So let me pause this video to interject a couple of comments here. First and foremost, GERD is characterized by an incompetent lower esophageal sphincter or cardiac sphincter, which is the ring-like muscle that divides the esophagus from the stomach. As you know, food moves from the esophagus down into the stomach, but it's not supposed to move in the opposite or retrograde direction. When it does, let me back up. The contents of the stomach here are very acidic. The pH of the stomach is between 1 and 3. The question is why? Many people actually believe that the low pH environment in the stomach has something to do with digestion. It in fact really doesn't, at least not directly. The reason why the stomach is so acidic is because in the stomach we have a number of very strong enzymes, very potent proteolytic enzymes. These are enzymes that are designed to chop up proteins. And these enzymes have no onboard intelligence. That is, they cannot distinguish the difference between proteins that you ingest as food, i.e. steak or tofu, versus the proteins that line the walls of your cells and tissues in your body. So whoever designed the universe was a very clever engineer. We can learn so much by simply looking at the body, at how the body was designed to work. In this particular case, whoever designed the universe, or millions of years of evolution, either way you look at it, understood that we want these very strong enzymes to be active here in the stomach where they're needed. But should they get out of the stomach, either up into the esophagus or down into the duodenum, which is the proximal section of the small intestine, or through the stomach wall if there's a gastric ulcer that leads to a perforation and the material gets out into the peritoneal cavity, we want those enzymes to turn off. In biochemistry, we call that a change in the shape or the conformation of the molecule, so that those enzymes do not continue to digest all of the proteins that they come in contact with outside the stomach. So the question is, and by the way, when the material moves from the stomach, which we now call chyme, up into the esophagus, this is what leads to the sensation of heartburn, which incidentally has nothing to do with your heart. It's simply the auto-digestion, if you will, of the columnar epithelial cells that line the esophagus here. The question is, does it make sense to treat a mechanical problem of the lower esophageal sphincter here, with a pharmaceutical solution? Well, let's think about this for a second. If a patient presents with a cardiac valve problem, a mitral valve insufficiency, for example. Are we going to find many cardiologists that would advocate treating that mitral valve insufficiency with a pharmaceutical solution? Absolutely not. We'd be hard pressed to find many cardiologists that would advocate using a drug to treat um, a mechanical problem. We might use the drug to mitigate the symptoms of the problem, but nobody, I hope certainly none of my medical students, would ever advocate using a drug to fix a mechanical problem. It doesn't make any sense. Does it make sense to do something similar in gastroenterology? Well, it must make sense to a heck of a lot of people because the proton pump inhibitors, the PPIs like the Nexiums and the Prilosec, and the H2 blockers, the Tagumets and so on, are among the most commonly prescribed class of drugs in the world. So it must make sense to treat a mechanical problem with a pharmaceutical solution in gastroenterology, but not in cardiology. Again, I hope everybody appreciates the irony here and my not so subtle use of humor here. And because we are treating the symptoms of the problem with the drug, let me just go a little bit further, but not the underlying problem itself, it is actually leading to the fastest growing cancer in our society today. Esophageal cancer has become the fastest growing cancer in our society in the last 2 decades. Why? Because many physicians and many patients believe that if you have a pain and you swallow a pill or you have a medical device put inside of you and the pain goes away, that it's the pill or the device that's solving the problem. In fact, that is not always the case. In this particular case, this is a wonderful example of what I call the law of unintended consequences and how it applies to medicine. In other words, by swallowing a pill, the symptoms of GERD, the heartburn, go away. Therefore, many would conclude, according to their logic, that the underlying disease has gone away. But because we have done nothing to fix the underlying problem, that is the reflux itself caused by the mechanical disorder, now we've created a new problem that in some cases is greater the problem than we solved. In other words, the esophageal cancer problem we have created is greater than the GERD itself. Now let me be very clear here. This is among the most controversial areas in gastroenterology today. Controversial in the sense that not everybody has bought into this idea yet. But that really doesn't bother me because a growing number of people, still very much in the minority, but a growing number of people are coming to the belief, or at least giving consideration, that the chronic use of all of these PPIs and H2 blockers are through a pathophysiological mechanism that we're not going to go into here. But in a nutshell, the reflux leads to dysplasia, leads to ultimately to esophageal cancer. A growing number of people are at least coming around to that realization, if not considering it. And let me just remind you that once upon a time, many people, the vast majority of people, thought the Earth was flat. In any event, the purpose of this case study here is not to talk too much about the pharmaceutical solution here. We're going to get back to the medical device solution, but before we do, here's the rest of the video. Okay, so as I said, GERD is first and foremost a mechanical problem caused by an incompetent lower esophageal sphincter, which oftentimes comes concurrent with sliding hiatal hernia as well. So let's go on and talk about a medical device solution to GERD, and that is using Enteryx.